My name is Jeni Leaird, and I am here to report on the Danish healthcare system. Denmark is a country situated in northern Europe and is the southernmost Nordic country. It is bordered by Germany, Norway, and Sweden. The Danish kingdom is comprised of a peninsula, a large archipelago, and two autonomous constituent countries, Greenland and Faroe Islands. Denmark's population ranks 115th in the world at 5.77 million residents, the majority living in or around the metropolitan areas. The largest city is the capital, Copenhagen, which has an urban population of 1.2 million and a metro population of 1.99 million. Its population density is 18,000 per square mile. Denmark operates using a Nordic model of government. Taxes are high with high levels of government spending. The government is a constitutional monarchy, with the monarch having central power as well as executive and legislative power, with the parliament being sovereign. The cabinet within the executive branch is monarch appointed, with all executive actions monitored and balanced by parliament. The parliament actually has more power than any other parliament in the European Union. The judiciary branch in Denmark is completely separate from both the parliament and the monarchy. The political climate and healthcare for Denmark are fused with an underlying principle written in Denmark's health law. The law obligates the government to promote population health while preventing and treating illness, suffering, and functional limitations. The core principles of the Danish healthcare system include high quality of care, easy access that includes equal access, short wait times for care, the ability to make choices in care, access to information as well as transparency. Health service responsibility falls on the regions and municipalities that deliver those services. The regulatory framework is set by the national government, who is charged with the general planning and supervision of the 5 administrative regions. The council is democratically elected and tasked with the coordination of specialized social care. Hospitals are managed and financed by regions, with the majority of services delivered by private general practitioners, office-based specialists, physiotherapists, dentists, and pharmacists. This places the emphasis for care at the primary level instead of tertiary levels. It is the municipality's responsibility to finance and deliver nursing home care, home nurses, health visitors, some dental services, school health services, home health, and drug and alcohol abuse treatments. They are also responsible for general prevention and rehabilitation. Immigrants make up 10% of the population, most of whom come from Turkey, Somalia, Iraq, South Asia, the Middle East, and Bosnia. The official state religion is the Evangelical Lutheran Church, with a vast majority of Danes being considered Christian. Although Denmark has an official religion, many politicians are atheists, and religion is rarely brought into the political arena. The Danish economy employs 80% of the population in the service sector. The income per capita is the 10th highest in the world, with an income inequality that is fairly minimal. Trade makes up 50% of the national's GDP. There is no minimum wage, and employment hovers around 4%, which is lower than most of the other countries in the European Union. All citizens of Denmark are automatically entitled to publicly financed health care. This care is considered free at the point of use. Undocumented immigrants and visitors are not covered, but have available a privately funded initiative supported by the Danish Red Cross and the Danish Refugee Aid, and provides access to care for those who are in need. Financing is mainly through a national tax that is set at 8%. Block grants are used to allocate revenue adjustments across regions and municipalities. These grants consist of 97% of the regional activities. Local taxes are also used to support the healthcare system. Complementary insurance is voluntary and purchased on an individual basis and is used to cover statutory copayments. These are mainly used for pharmaceutical and dental care. 2.2 million residents purchase voluntary insurance through a not-for-profit organization, while another 1.5 million purchase through a supplementary insurance that is a for-profit provider, and it allows them to gain access to private providers. These policies are often considered a fringe benefit given by employers, although some public sector employees are also covered. Students, pensioners, and unemployed, and others that are outside the job market are not covered. All primary, specialist, hospital, and preventive care that includes mental health and long-term care services are publicly financed. Dental services for children under 18 are also covered. The government subsidizes outpatient prescription drugs, adult dental care, physiotherapy, and optometry services. Each region throughout the country organizes and finances home care and hospice care. Benefit packages do not exist, as there are few restrictions. As long as treatments are evidence-based and clinically proven, treatment options remain with the practitioner. Research indicates that Danes report high levels of satisfaction with Denmark's telephone triage system. Use of the system helps direct the population to the appropriate care, reducing the use of the more costly health services. However, the survey indicates that waiting times for the service are more of an issue. Some 43% of people reported the waiting time for contact was too long, while 37% reported the time to be put through to a doctor was too long. This suggests a need to expand the availability of doctors for those patients, which is just over half, whose cases were not resolved by nurses. Denmark has incurred a steady but unremarkable population increase. Birth rates are only slightly higher than the death rate, 10.5 versus 10.3. The average age for the population is 42 years. 29% of Denmark's population is young and not working yet, while 50% of the population are of working age, and 19% are considered mature. The National Health Expenditures Accounts are the official estimates of total healthcare spending in the United States. It dates back to 1960 and measures the annual U.S. expenditures for healthcare goods and services, public health activities, government administration, and net cost of health insurance and investments, all related to healthcare. The U.S. healthcare spending reaches $3.5 trillion, or $10,739 per person, while Denmark spent the equivalent of US dollars, $4,553 per person. Denmark spends 10.4% of the gross domestic product on healthcare compared to the US, who spends 17%. Even though Denmark spends less per GDP, they are ranked higher in health status. As you can see, infant mortality, maternal mortality, life expectancies. Their vaccination rates are higher, and their smoking rates are lower. Denmark cares for their mature population by publicly financing long-term care services. Each region throughout the country organizes and finances that home care and hospice care. The responsibility for care is provided by the 98 municipalities who decide on the specific methods and services to be provided. This is based on the assessment of individual needs. They have a senior citizens council that's elected for 4-year terms. This council are citizens over the age of 60, and all citizens over the age of 60 have the right to vote for the services to be provided. They also run for council and determine the needs for their region and what services are provided. All citizens are eligible for home care services, with 12% of the elderly over 65 receiving services that range from cleaning and laundering to personal care such as bathing and shaving. Clearly, people in Denmark are well cared for within the healthcare domain. Structural elements allow for an environment that is prosperous and a healthcare system with easy access. These elements include a relatively small, homogeneous country, Danish residents with a deep-rooted sense of solidarity, progressiveness, and collectivism. Their welfare model demands equal rights for social security, healthcare, and education. Access requires a relatively high taxation as well as trust in the welfare system, who plays a central role in the mediation of affairs between citizens and the state. Participation in politics is crucial for the maintenance of such a democracy. This shows by 90% of the Danish population who participate in voting. This is compared to the only 50% of Americans who vote. Thank you for listening to this presentation of the Danish healthcare system.